Here today to discuss the case is Dr. Brian Day, an orthopedic surgeon who brought this challenge along with a number of patients. Thank you so much for joining me today, Dr. Day. Now, why don't you tell me a bit about the background of the case, why you brought the challenge, and how patient rights are violated by these laws?
Yes, we launched the case in 2009, and that's because the government of the day decided to implement the laws that had been in effect for many years. And we actually opened our clinic in 1996, and that was we opened it because surgeons were leaving the country, patients couldn't get treated. We had my OR time, like many of my colleagues, went down from 22 hours a week in the public hospital to 5 hours. So it was either, and when you've got 450 patients waiting, that's not going to work. And so a group of us got together and decided to get this clinic together with some philanthropists who our founding shareholders donated over $100 million to the public health system in BC. So this was not the motive. The motive was we needed somewhere to treat patients. We were operating for many years, and then suddenly a government came in that decided that didn't fit in with their ideology.
And so the clinics have been operating for a long time. What led the government to say, hey, you know what, we're going to come in and tell these clinics that are helping patients that they need to be shut down? Like, what changed? Why did the government do that?
Well, it was political, and that's what this whole topic is. It's political, that they were pressured by opponents who were mostly public sector unions. The nurses union actually was the most prominent in pushing for the laws that had been ignored for years. I mean, the law was there. It was basically what we described as an unlawful law, like many laws historically have been. And we decided that patients were suffering and we needed to do something about it.
So patients are suffering. That's the main issue here in this case. Can you explain what the wait time situation has been like in BC and how these laws lead to the rights of patients being violated?
Well, essentially what governments have done in British Columbia, actually BC is I think the only province that's actually enacted the 5 principles of the Canada Health Act into provincial law. So it's actually part of provincial law that access be timely in British Columbia. And it is a requirement of the Canada Health Act, but it's also a BC requirement. And so we felt and we feel still that the BC government is in violation of their own laws. We felt that it was unlawful, and we had constitutional experts, some of the best minds like Peter Hogg, who was the author of the standard textbook on constitutional law. He said that you cannot legally create a monopoly in it. You're the person or individual or entity that's going to provide care in a timely manner, then not provide it in a timely manner, and then outlaw the patient's right to do something about it.
Exactly, which is basically what has happened to so many of those patients in British Columbia.
Yeah.
We've got to go to commercial break, but we will be right back to discuss this further.